So Lynda Robinson, all the way from Ohio, is going to be sharing with us her work with hospital healthcare providers. And we're more or less continuing this medical theme, and it's so good to see you, and welcome.
Thank you. Sorry, they're setting up. I chose to use Canva, which is a new experience for me, and we're just setting it up.
Okay, stretch break, everybody. Stand up, lift your arms up, come up on your tiptoes.
Is that your?
Yeah. Yes.
Didn't take a break.
I know.
Better now.
Yeah. All right.
Okay. All right, we're ready now.
She'd still be show. Yeah, so you'll see.
Okay, so I'm gonna hide behind the podium because I'm not off script. My son had, my 9-year-old son had just been a very successful character of Chip in Beauty and the Beast. And he's watching and he can relate right now. I'm not off script. So I want to start out with introducing myself as a healthcare provider. I'm an occupational therapist in Cleveland, Ohio at the Cleveland Clinic. And I'm sorry, my title doesn't truly reflect what I'm going to be talking about today. And I'll go into that a little bit later. But overall, from this LMU program, Yoga for Leadership in Healthcare Providers has been my takeaway experience. And just to tell you a little bit more about my clinical position, I work at a community hospital, which is called South Point Hospital. And it's a community hospital of the Cleveland Clinic, which is #1 in adult cardiology and heart surgery. Should be towards the computer. I enrolled in the LMU Yoga Studies program with the intention of gaining better clarity on how to promote health and wellness in patients with chronic conditions such as hypertension. I have a special interest at heart, and I'm coming here with vulnerability, so I apologize. And I probably shouldn't have put this in my slide. But my special interest at heart is because my mother had died from hypertension. I'm sorry. So this program has helped me heal from my grief. And it has helped me have more empathy for my patients. Sorry, I'm still healing. Thank you. Okay, thank you. Okay. Part of my healing was bringing my son to India with me. Thank you, Dr. Chappell. And the pandemic has burnt me out as a healthcare provider. And learning ahimsa and Jainism in the Jainism course has opened my eyes both academically and spiritually. So I want to go into the concept of ahimsa. As a healthcare provider, doing no harm is an ethical principle called non-maleficence. And is already integrated into my clinical practice. My academic inquiry is how may I practice ahimsa in clinical care in the salutogenic form of wellness and health promotion. I will further define salutogenesis as it relates to my research study. My academic objective is twofold. And what I found interesting was that in the Patanjali Yoga Sutras, ahimsa is considered a yama, and in the Hatha Pradipika is considered a niyama, with yama being more related to the social codes and niyama to personal development. In my thesis objectives, I provide yoga and therapeutic interventions to promote wellness to patients in my community hospital. And in the Hatha perspective of ahimsa as a niyama, leadership improves through a disciplined personal practice, utilizing yoga with focus on non-harm. In my background research, I discovered, I was actually inspired in 2021 from our hospital readmission quality improvement director, Dr. Chanda. And Dr. Chanda is the PI for my IRB approved research study, has tasked the hospital managers to find ways to reduce readmissions. And it became our rehab department goal that year. The clinical inspiration for my study was to uncover reasons why CHF was the second most common diagnosis for readmissions. After performing a literature review, I found that cardiovascular conditions, and specifically CHF, was a problem for hospital readmissions nationwide. The problem that I wanted to focus on was why my patients were not, why their hypertension was not being treated. And problem number two, I wanted to understand what was limiting in discovering from the research review, part of the issues in not treating hypertension in the patient population I was seeing was due to poor patient-provider communication. And I wanted to dive a little bit deeper into what was creating a barrier with provider communication with our patients. Blacks are 2 to 3 times more likely as whites to die of preventable heart disease and stroke. Control and effective treatment of hypertension, a leading cause of cardiovascular disease among Blacks, is less than in whites and remains a challenge. And this is due to cultural beliefs and the perspective that medication is only needed symptomatically. For example, in my patients that I see, I prescribe exercise. And when their blood pressure is too high, I cannot work with them or evaluate them to return them back to their jobs because of untreated hypertension. And when asked why they're not taking their medication, I'm often told that the lightheadedness, dizziness was just a normal. And my patients, or the patients that I work with, were often turned away from the emergency room. In this graph of outlining the health disparities amongst African American as compared to Caucasian and Hispanic, as you see here, African Americans have a higher rate of cardiovascular disease, heart failure, and hypertension, as well as the higher mortality rate. And as you see here, and can this be attributed to poor patient-provider communication? The number of visits with Caucasians visiting their doctor is much higher, and the emergency visits are much higher in African Americans. So unfortunately, because of the pandemic, our hospital had I want to say 90% turnover of the nurses, and our hospital was not staffed well. Due to this lack of staffing, a lot of our patients were turned away from the emergency room. So I want to give it more of a global perspective. So what we had discovered in our Diversity, Equity, and Inclusion Committee at South Point Hospital was that our specific patient population at South Point Hospital responded very well to health fairs and taking their blood pressure and finding out that they did have hypertension at these health fairs. So in the spirit of building a community class, I developed Yoga for a Healthy Heart study through my health sciences graduate class. And in this Yoga for a Heart Healthy study, my intention was to develop a community class that combined education for how to take a blood pressure, as well as yoga for how to manage stress. In a 2010 study by Poland, yoga has been shown to be beneficial in reducing heart disease and heart failure in African Americans. But as I was referring providers and selling or trying to promote the study in the hospital, the cardiologist mentioned to me, we know yoga works, but what is different about your study? So I wanted to also address the medication management as an occupational therapist, the lifestyle modification through the stress management techniques of yoga, and also we had a developing community center. And in this community center, we were promoting research and health programs as a DEI initiative for the hospital. As an occupational therapist, I specifically address how patients participate in activities of daily living. And in this study, I will be addressing how hypertension has prevented the participants from participating in their daily activities. I've already started recruiting at the hospital from 2 different cardiology offices. Currently, just from one cardiology office due to the IRB restrictions. As a recruiter, I'm only allowed to educate the referring providers, not allowed to look in the patient's charts or bias the recruitment process at all. So my recruitment is of 12 African Americans with hypertension who are already regularly seeing cardiologists and receiving medication. This is a preliminary single cohort study. And this is really just an extension of what the cardiologist already recommends, which is typical recommendations of healthy lifestyle habits, such as exercise, nutrition, yoga, tai chi, and other meditative stress management practices. And the cardiologist already has a program associated with their office that is a cardiac rehab, but due to the restrictions of the rehab, and from what I understand is once a patient has a cardiac event, they only have 12 months to schedule this 10-week program. And they do not address embodied stress management. So having this program adjunctive to the cardiac rehab program was very timely. In the methodology, I wanted to go, I wanted to see my patients one-on-one to build trust and understand their commitment to the healthy lifestyle. And I am able to do this through the Canadian Occupational Performance Measurement, which is a motivational interview of which I can set goals and promote self-efficacy and insight into what somebody wants to work on through these stress management techniques that they'll be learning. My other measurement scale is the perceived stress scale. And the perceived stress scale measures negative affectivity, which is the ability to how somebody sees an event and whether they catastrophize it or see it as a growth opportunity. And the Medicog, which is what I do as an occupational therapist in the hospital setting, addresses if cognition is a barrier to managing medication. Also assesses if short-term memory or ability to follow multi-step directions is limiting patients from taking their medication. And as the other speakers before me had mentioned, the perspective of salutogenesis. As Lee, I would like to define the salutogenesis from Lee Majewski's book, Yoga Therapy as a Whole Person Approach to Health. And how I'm using salutogenesis in my study is that as it is connected with yoga therapy, perspective is shifted from disease focus to health focus. When I first became interested in yoga, I was asked, why am I taking a yoga master's course? Is it so that I could teach yoga in a studio? And of course, I'm here to educate my fellow coworkers on salutogenesis and how yoga can promote health in an illness setting. And in the design of the study, what's in red is what I normally would teach as a medical provider, which is the health education, and turn that into mindful communication. In the study, we'll be discussing different mindfulness themes and different themes based on the yamas and niyamas. And then in my medical perspective as an OT, what I would typically teach is therapeutic exercise, but through my yoga therapy lens, it'll be a somatic chair breathing coordinated with activity and movement based yoga asana. And in the design intervention, the theme that I would normally teach as an occupational therapist, which would be energy conservation, will be taught through the lens of diaphragmatic breathing and rebalancing the nervous system through yoga. Sorry, I'm off. My first participant that I had recruited, I met with, and we met regarding her specific goals. And in the motivational interview, she indicated that she was in the class because she needed to get her life back. She had also experienced grief, severe grief, and it had impacted both her mental and her physical health. And as we were discussing all that she had lost, her first goals were based on her physical weaknesses. And then her overall self-efficacy goal was that she needed to recover from her grief and return to her and get her identity back as a nurse. Excuse me. So I wasn't sure if this study was going to go through, and I wanted to focus on hospital provider, healthcare provider stress and how it was impacting our patient population. The reason why this research, it was a 2-year process. The reason why it finally came through is the community center picked up on the idea that we can build more trust in our community by using research as a resource. And by, so the community director of the hospital started putting a table up of research advocates to discuss with our patients passing by for their medical appointments, all the opportunities that they could take advantage of all the healthcare providers that want to help provide equitable services through research. So really this is a booming time for research at the South Point Hospital Community Center. And that's all I really wanted to talk about for this evening. But there's going to be more about the healthcare stress in my thesis. Thank you so much for your patience.